Jonathan Murphy, MD, MDH here. I'm an internal medicine pediatric homeopathic specialist in Phoenix, Arizona, and I'm here to talk about some issues that are near and dear to my heart, including the preventative effects of chelation therapy. We think of chelation therapy as being able to do the biggest preventatives of all by getting rid of the cause that is underlying so many diseases. The studies are there now, and you may have heard me speak about the Switzerland study that showed a 90% reduction in cancer mortality in patients who did chelation as a preventative, not once they develop cancer. The bigger picture of this is that underlying it all are oftentimes free radicals and heavy metals, which are removed by chelation therapy, are the main generators of free radicals. Oh, sure, you'll get some from, deep fried foods, and you'll get some free radicals from, walking around in traffic is heavy. But the main free radicals produced within our own system, especially the vascular system and even the tissue level, are made by things like lead, cadmium, arsenic, antimony, mercury, nickel, uranium, you name these toxic metals. And they are generating oodles and oodles, if you like that word, of free radicals, and they just do it continuously without destroying themselves. So these free radicals create a condition known as inflammation. So one of the reasons why I like to do chelation therapy as a preventative in my patients is to reduce their inflammation to prevent diseases. So I think you've heard me talk about the TACT trial, Dr. Lamas, and the 40% reduction in cardiovascular events among diabetics. And I'm sure if they do the sub-analysis, they'll also find that in people who have metabolic syndrome, who are at the highest risk of cardiovascular events, coronary artery issues, cerebrovascular issues. And the other reason why EDTA or innate chelation therapy seems to work is that it allows our body to be more capable of doing repair work underlying it all. Now that's something that's of my own opinion. I don't have the citation, but in my experience, chelation seems to make everybody feel a little bit younger. I started my chelation therapy back in the 1990s, and after you go through about 20 or 30 intravenous treatments with innate or EDTA, your body will have gotten rid of a significant amount of the toxic metals through the urinary tract. And in fact, when we have measured people's urinary provoked toxic metals, a 6-hour sample of urine, followed by a chelation series in which they do 20 to 30 chelation treatments with EDTA. Then we remeasure, and we usually find about a 50% or more reduction in their toxic metals. So if you were to think of cadmium or lead, lead is the most chelated by EDTA, but if you were thinking of lead sitting one molecule in every cell of your body, just generating free radicals and inflammation, and then you were to think that I removed half of that lead from my body, and then I continue to remove it for a few more years, you would have the TACT trial. 18 years, you would have the Switzerland chelation trial. And these are where we have all the evidence that chelation is among the best preventatives, even better than a daily aspirin, even better than eating your vegetables. It seems as if it helps to get rid of the cause of disease, which is the toxic metals. And they do build up in our body, first of all, because they're in our environment. They were added to gasoline to make higher octane. They were added to paint to make it more durable. They've been added and in so many things, even injectables, which have aluminum, sometimes mercury and aluminum. We're getting it from many, many sources. And the downside to heavy metals is they stay around our body for a long time. We don't get rid of them quickly. So they stay around our body for 10 to 20, and in the case of mercury in the brain, possibly even as long as 40 years of half-life, meaning half would be removed in 40 years, or half-life of 10 years would mean half will be removed in 10 years by the body's own natural mechanisms of excretion. But if we do chelation, we get rid of half of them in 6 months or so. And so the idea of we're constantly being exposed to toxic metals and taking them onto our body because they do absorb through skin, through gut, through so many different methods. And as we get rid of our heavy metals, our bodies create less inflammation and less free radicals, and our bodies can do more of maintenance, and that's called prevention.